Welcome to Rerzeh Health, your ultimate health and wellness guide. Subscribe for easy-to-follow health guides, motivation, and expert insights to transform your health. Have you ever had a high fever, severe body pain, and extreme fatigue that just wouldn't go away? You might have had dengue fever, a mosquito-borne viral infection that affects millions of people worldwide. Dengue is more common in tropical and subtropical regions, but cases have been rising globally. In today's video, we'll explore everything you need to know about dengue, its causes, risk factors, symptoms, and most importantly, how to prevent and treat it. Let's dive in. 1. What is dengue? Dengue is caused by the dengue virus, DENV, which is transmitted to humans through the bite of an infected Aedes mosquito, primarily Aedes aegypti. There are 4 different strains of the dengue virus: DENV1, DENV2, DENV3, and DENV4, meaning a person can get dengue up to 4 times in their lifetime. The virus spreads through the bloodstream, triggering an immune response that leads to fever, body aches, and other symptoms. 2. How is dengue transmitted? Dengue spreads when an infected mosquito bites a person, transferring the virus into their bloodstream. However, it cannot spread directly from person to person. Mosquitoes act as carriers. High-risk areas for dengue include tropical and subtropical regions, Asia, South America, Africa, urban and semi-urban areas with stagnant water, areas with high mosquito populations. 3. Symptoms of dengue fever. Dengue symptoms usually appear 4 to 10 days after a mosquito bite and can range from mild to severe. The most common symptoms include high fever, 104 degrees Fahrenheit or 40 degrees Celsius, severe body aches and joint pain, nicknamed breakbone fever, intense headache, especially behind the eyes, nausea, vomiting, and loss of appetite, skin rashes, developing 2 to 5 days after fever starts, fatigue and weakness. For most people, symptoms improve in about 1 to 2 weeks, but in severe cases, dengue can lead to life-threatening complications. 4. Dengue hemorrhagic fever and severe dengue. In some cases, dengue can become severe, leading to dengue hemorrhagic fever, DHF, or severe dengue, which can be deadly. Warning signs include bleeding from gums, nose, or under the skin, severe stomach pain and persistent vomiting, difficulty breathing, low blood pressure and shock, dengue shock syndrome. If you or a loved one experience these symptoms, seek emergency medical help immediately. 5. Risk factors for dengue. Certain groups of people are more at risk of developing severe dengue. People living in or traveling to dengue endemic regions, young children and the elderly, people with weak immune systems, individuals who have had dengue before. Reinfection can be more severe. By taking proper precautions, the risk of infection can be greatly reduced. 6. How to prevent dengue. Prevention is the best defense against dengue. Here's how you can protect yourself and your family. Eliminate mosquito breeding sites. Remove standing water from buckets, tires, and plant pots. Use mosquito repellents. Apply insect repellents containing DEET or picaridin. Wear protective clothing. Long-sleeved shirts and pants help prevent bites. Use mosquito nets and screens. Sleep under mosquito nets, especially in high-risk areas. Community efforts. Governments often conduct mosquito control programs like fogging and spraying. By controlling the mosquito population, we can significantly reduce the spread of dengue. 7. Diagnosis of dengue. If you suspect dengue, visit a doctor for proper diagnosis. The most common tests used include Dengue NS1 antigen test, detects the virus in the early stages. Dengue IgM-IgG antibody test, checks for antibodies against dengue. Complete blood count, CBC, monitors platelet levels, which drop in severe dengue cases. 8. Treatment for dengue fever. There is no specific antiviral treatment for dengue, but supportive care can help manage symptoms. Recommended treatments include rest and hydration. Drink plenty of fluids to prevent dehydration. Pain relievers. Paracetamol helps reduce fever and pain. Avoid aspirin or ibuprofen as they can increase bleeding risk. Electrolytes and IV fluids. For severe cases, hospitalization and IV fluids may be necessary. Most cases recover within 1-2 weeks, but severe dengue requires immediate medical attention. 9. Dengue vaccination. There is now a vaccine for dengue called Dengvaxia, approved in some countries for people who have had previous dengue infections. However, it is not widely available and should only be taken under medical guidance. Researchers are working on better vaccines for future prevention. Stay safe from dengue. Dengue fever is a serious disease, but with proper awareness, prevention, and early treatment, we can reduce its impact. Always take mosquito precautions, stay informed, and seek medical help if you experience symptoms. Stay safe, stay healthy, and protect yourself from dengue. Like, share and subscribe for more health tips.